guys, welcome to another episode of Reactivity on the Road. Claire Lawrence here, involved in everything in the show. Happy days. Welcome to another episode. So this week, I got asked about this a lot. Claire, I really struggle to take my dog to the vet. And having had a previously vet reactive dog, I can wholeheartedly understand the difficulty, the severity, the struggles with safety that can be involved in just taking your dogs to the vets for something as simple as inoculations or treatment, or like I say, if they're in pain, getting them what it is that they need so that they're not in pain anymore. Now here's the thing. Dogs who struggle with the vets have more often than not had a difficult encounter or experience there. The pheromones and the scents that are in the vets are not always the best. You know, if you've got a lot of fearful, anxious, avoidant dogs going in there, they're emitting scent, and dogs see the world through the nose and they will pick up on these smells, and some dogs can be affected just by the smells that they encounter. So that's one thing. But the main thing, I think, where people struggle is that the dog is only going to the vets when they're in pain, when they're in discomfort, they're being prodded and poked around that they're not perhaps ready or been prepped for. And it's very easy and very quick for them to learn that that place is not a great place to be. And when you're a dog, you've got two ways of displaying that you're unhappy. Avoidance and submitting, if you like, backing up, clearly displaying that you are uncomfortable and submissive. Or you go the other way and you go, fuck this, and you get defensive. And the way that dogs can defend themselves mostly is by aggression, growling, lunging, snapping, air snapping. Some even go as far as trying to bite the vets. As I said earlier, my vet reactive dog had a really severe issue with the vets. We don't know what happened. We suspect he went in for his neutering when he was 2-3 years old, and he was fine with the vets before that time. So something happened in that surgery or in that environment that he didn't like, and when we went to take him back in again, he was pretty severely reactive, and I never got to the bottom of what that was because I wasn't there to see it. So I imagine with especially a lot of the COVID restrictions, you know, I'm not blaming vets. They have a job to do. It's their duty of care to ensure that an animal is well cared for and that they get their medical treatment. Unfortunately, they've got time limits, and a lot of dogs can be restrained or forced into situations that they're not comfortable with by somebody that they don't know, and you've got yourself a problem. So what I wanted to look at in this episode is not only some of the things that I do when I'm at the vets and I need to be at the vets, but what I urge you to do is to go to the vets when you're not needed at the vets. As we've just said, if your dog is always going there when something's wrong, it's going to become a very unhappy place to be. Whereas if you're going there and you're doing nice things with your dog, eating their dinner, playing, settle training, we're going to have a look at it all in the episode, then you can start to counterbalance the good and the bad. And if you're really dedicated to overcoming your dog's vet's issues, then you can go further and you can tip the scale so that the vets is the most amazing place to be, and there's no bad things happen at the vets. There's a lot of hard work when it comes to changing a dog's emotional response to triggers, to environments and to situations, but it is very possible if you follow a structure and you are consistent with it, and like I said, if you are dedicated to ensuring that your dog is happy, which a lot of owners want their dogs to be happy, but it's going to take some work. So we're going to have a look into this episode, and we're actually going to have a look at a whole variety of things. Some of the things I've just mentioned there, but on the topic of a veterinary episode, I wanted to discuss a little bit more into things that you can prep your dog for before actually going to the vets. And also we're going to take a super short look at the dietary requirements that I feed my dogs I must stress that I would like you to do your own research into this, but I wanted to give you an insight into how diet can impact a dog's behaviour, and as I've just said, what it is that I feed my dogs to make sure that they are running at optimum performance and that their behaviour isn't being affected by their diet. So, shut up, Claire. Let's go and get into the episodes. Enjoy the show. I want to start by apologising for the filming. I've done a lot of this in landscape and not horizontal, so it's a little bit screwed on the screen. But before you go and work at the vets, make sure you take your dog for a little walk in and around the vets, because chances are when you get there, and I'll speak about this in a minute, you're going to see a lot of other stuff, and if you've got a reactive dog, the sight of those triggers can send them up into a reaction. That's not what we're after. We're looking for calm, we're looking for happy, and we're looking for positive. So a walk before you go and work. I found it a little bit tricky on where to start on this episode, and that's because there are lots of moving factors. So what I decided to do was start from the outside. Now, when you go to the vets, chances are you're going to encounter a lot of different dogs coming in and out of the surgery. So for me, I like to do exposure sessions around the vets and outside of the vets that get the dog accustomed to working there, being rewarded there, doing some nice simple activities such as looking at me, focusing, all of the fun stuff that you can think of to get your dog to pay attention to, but also enjoy their time around the outside of the vet's environment. Now, for the most part, vets can be really helpful, and it pays to just speak to them and go in without your dog and just say, do you mind if I hang around here and just do some training with my dog outside and use your land to help them readjust to the setting. A good vet will not mind that, and if they do, I'd be looking at changing vets, to be honest. But a good vet, and a lot of vets actually want the dogs to have a positive experience in their surgery and definitely around the location. So speak to your vet, tell them what you're doing, that you're going to be lingering around, and just help your dog by doing simple exercises. Here we are parking the dog on the lead. That means I'm stood on the lead. Personally, I would like a longer lead. You want to be able to stand on the lead so that your dog can stand up, but it restricts them from moving out all around and over the place. Then you can just do a simple activity such as feeding for connection and engagement. And you can do sessions of this once, twice a week would be absolutely fine. If you really stuck the time, once a month would be better than none a month. If you've spent some time outside, then you want to work on going into the surgery. Again, speak to your vet, find out when the quiet times are. Do simple activities such as getting your dog to lie down and wait on the weighing scales, because when you go to the vets, they usually want to check what sort of weight the dog is, and just use this time to have fun, do some tricks together. Again, lots of reinforcement, little bits of weight training there, treats come in, all good fun. Again, if you commit to this process once a week, once a month, you will soon find that your dog is really eager to get into the vets. Another really useful skill that you can help your dog to learn is how to settle outside. For the most part, when dogs go outside, it's all activity and it's all on the go, walking, seeing, doing, sniffing. Whereas if we just take a minute to teach the dog that sometimes we stop and sometimes we relax, then you can really put this skill into practice at your vet surgery. A lot of the things that you see me do in this series involve food, and for the most part that's because all dogs are food motivated. If you want to increase your dog's desire for food, you can try hand feeding on every session. When you've done a lot of this prep work and your dog actually has to go in for veterinary treatment, this can be really tough. Now, a few things that I like to do is make sure that I've got muzzle trained dogs. That means my dog is comfortable and accepting of wearing the muzzle. If my dog is ever in for any treatment whatsoever, I am not stingy with the rewards. My dog can have treat after treat, support after support. If they're a more toy motivated dog, I would save that for afterwards, but I'm not stingy with helping and supporting and reinforcing my dog through this process. Other reason for this is because I've had a vet reactive dog, it's very difficult to come back from. So not only do we keep the reinforcement high, but I always have a conversation with my vet before they even put their hands onto my dog, and I explain the situation. For this dog in particular, I'm like, hey, look, he's a little bit more sensitive. I don't want to develop a problem. I want to try and keep things as comfortable as they can. Can you work with me? And any decent vet will listen to you, will respect that you are advocating for your animal, and will go at the pace that you set for your dog. Of course, they've got a job to do, but you can ask your dog to stop if you feel that your dog is getting too stressed. This visit that we had to the vets was actually a really good one. The vet was patient, he'd listened to me. He's not doing anything too intrusive to Hunter that he wouldn't be and wouldn't had been prepared for before. We had a little bit of muzzle scuffling, but on the whole he's generally good wearing his muzzle. So there was no major incidents with this session. However, there was a time where he actually growled at the next vet. So the thing he was in for previously was fine. Then we went back in and he had some sort of ear infection or issue. And he growled at the vets because he didn't feel comfortable. I asked to stop that session so as not to push my dog into reacting or developing any sort of fear in the future of the vet surgery. Whilst vets have a duty of care to ensure that animals do get the treatment they need, and I agree with that, what I don't want to do is ever put my dog into a situation where he feels that he needs to use that growling or escalate into behaviours such as biting or snapping because he doesn't feel comfortable. You can ask your vet to stop that consult and you can tell them that you'll be back in a couple of days. Something that we're teaching here, and this was after the event of growling, is actually touching my hand as I go to inspect your ear. Teaching a durational hand touch can be invaluable and you can use it for various things. For us here, as I said, touch my hand whilst you are inspected. If you are uncomfortable at any time, you can pull your nose away and we will stop the process. This really gives dogs a choice in the matter and we can learn to listen to what they're comfortable with and what they're not. Let's go and take a look at how we can teach the durational hand touch. Let's look at the hand touch. First things first, the reward comes from behind your hand. Reward placement is important. Your dog should go to investigate, touch, then reward. Repeat this until it's fluid. Then I like to make this activity a little bit more exciting. Because it can get boring for dogs, we add in the movement, and with this movement we then get hard pushes. Then we only reward the hard pushes. You want a nice squidgy nose. Adding the duration part can be a little bit monotonous, and it's best to do so second by second. That means 1 second touch reward, progress to 2 second touch reward, and so on and so forth. Then it comes to adding in the distractions. For us, we're working on the ear, so I'm going to work around that part of his body, but you can work on whatever part of the body that you're working on with your dog. Always remember that if your dog holds their touch, then you can continue. If they remove their touch, then you need to stop doing what you're doing, and this really helps the dog learn about their consent in the activity. So your first job is to feed your dog with the item next to the dinner. Then you progress to turning it on. Then you want the items to be on and just touching the foot. At no point are we making an advance with the nail grinder. We're just touching and conditioning this process. Then what we can move on to is actually picking the foot up. Again, still no contact with that grinder.
Good girl.
Then I will work on putting the grinder to the foot and rewarding, but again, still not contacting with that nail. When I do make contact with the nail, the very first time I do it, it's going to be short, sharp, and sweet.
Well done.
Good. You want to ensure at all times that your dog is comfortable through this process.
Marker, wasn't it? Good. That was another squeaky marker.
Then you can slowly start to build up the duration of how long that nail grinder is on the nail for.
Very good girl. Yes.
I find these a lot better than the nail clippers, especially for dogs who have found that nail clippers are aversive.
Good girl, you're so smart.
That's how I'd go about doing it. Now, your dog might take a little bit longer on each stage, and that's totally fine. Work at your dog's pace. You want to try and avoid any pullbacks or getting up and walking away, and you definitely don't want to ruin the relationship between you. I hope that helps. Don't forget as well that if your vet slips out of the consult room, get onto it, get training, get rewarding, get having some fun with your dog to help them, again, to readjust that
being in this place is a really great place to be. Keep it simple, keep it easy with things that your dog already knows, and reward, reward, reward. Because diet plays such a huge impact on a dog's behaviour, it's worth looking at what it is that you're actually feeding your dog. As I said at the beginning, please do your own research for your individual dog. My guys get a raw meat diet every day, and within it I try to include as much safe, fresh food as I possibly can. Our mix contains things such as carrots, broccoli, maybe some strawberries, blueberries, some rice or porridge mixed in there to bulk it out, and various different things that are healthy for my dog. Some vets can be a little bit funny about this, but I have never had a bad experience with the raw diet, and I've actually seen huge behavioural changes just from feeding as much fresh food as I possibly can. When we tie this in with the vet trips, you can do something as simple as taking your dog's dinner and their diet to the vets and feeding them outside of the surgery, so you can fast track that great response for being in that vicinity. What this can also do is ensure that your dog is having good input and making sure that their bodily systems are getting the health and nutrition that they need, and less of the shit that they put in the kibble, which can cause hyperactivities. We hope you've enjoyed this episode, and if you need more help, you know where to find us. Coming up next is more camping, this time in an unknown location.